Middle childhood, the period between early childhood and early adolescence, ages 6 through 11, by Cameron Tenorio, Chanel Allred, Guadalupe Moreno, Victoria Lynn, and Brianna Carter. During middle childhood, biosocial development continues and changes in growth and strength occur. The growth during this time is slow and steady. A child's maturation improves as well as a child's strength, understanding, coordination, self-care, and independence. One noticeable change is the teeth development. The loss of baby teeth occurs and the permanent teeth grow in. Middle childhood depends greatly on a balanced diet, physical activity, sleep, and environmental factors. Nature and nurture. During this time, a child is in the healthiest of the entire lifespan, since the risk of illness and death rates decrease with growth. Even though rates of illnesses and death decrease, a child's health can still be at risk with health problems like obesity and asthma. Health problems in middle childhood. Overweight and obesity. These both focus on BMI, which is body mass index. If a child's BMI is above the 85th percentile, they are considered overweight. If their BMI is over the 95th percentile, a child is considered obese. Contributors of obesity are lack of physical activity, poor diet, and genetics, as genetics influences activity level, hunger, metabolism, and body type. Asthma is a chronic disease of the respiratory system. The inflammation of airways causes difficulties with breathing. Asthma originates from genetics like obesity and is usually triggered by environmental allergens. Recommendations are a balanced diet and regular physical activity, and limiting screen time. Obesity can lead to asthma and other health risks like high blood pressure and high cholesterol levels. As middle childhood growth progresses, so does a child's brain development. The brain continues to grow and form connections between hubs that are important for healthy brain function and emotional regulation. Improvements in brain development are reaction time, selective attention, and automation. During middle childhood, children are assessed by numerous tests such as IQ, brain scans, and aptitude tests. These tests are done to measure intelligence, academic achievement, and to see if there are any problems with brain development. Since early recognition is important, these tests also help assess if a child is gifted and talented or if a child needs special educational assistance. Special help is required to help a child learn when a child has a physical or mental disability.
Theories of middle childhood. Piaget. Develop the ability to make more complicated decisions. Middle childhood is a time of concrete operational thought. Concrete thinking comes from what is visible, tangible, and real. Children begin to think more logically and reasonable to understand the world. This is an important stage between early development and thinking abstractly. Piaget believed children would discover most concepts themselves. Piaget also believed children in this stage become more systematic, objective, and scientific. Theories of middle childhood. Vygotsky. Vygotsky believed that the education system based on memory wouldn't help children make decisions in real-life situations. Vygotsky felt educators should consider children's thought processes and not just the outcome. He believed children would benefit from direct learning from teachers and mentors, and the children would gain more knowledge than they would learning concepts by themselves. Vygotsky said that every experience from birth on is a lesson for the child. The particular lessons just vary by culture. He believed that a child's home was the primary source of education.
Now, let us go on with a list of tools that are utilized to assess developmental status in the middle childhood. The first one up is developmental monitoring. This is where the provider asks the parents about any concerns they may have about their child or children. They are also obtaining a developmental history, observing the child, identifying any risk and protective factors, as well as documenting the findings. The second one up is developmental screening. This includes the visits that occur at 9, 18, 24, and 30 months. They're more in-depth than monitoring and may identify children with a developmental risk that was not previously identified during the developmental monitoring. The third one is teaching parents and caregivers to recognize developmental milestones. This means that parents who are aware of developmental milestones can observe their child and inform their health care provider about any concerns that they may have about their child's development. Some pediatrics may even provide the parent with a milestone checklist to help them track their child's milestone at home. The fourth one is ensuring that all children have a medical home. The first reason would be that they must have a consistent access to health care that is comprehensive, well coordinated, and of high quality, and that of course that they could provide an ongoing relationship with their personal providers who treat the child to their fullest. Second reason is identifying the children with diagnosed developmental disorders as children with special health care needs and managing their care as a chronic condition. Third reason is coordinating with specialists about additional evaluation that the child may need. And the fourth reason is integrating feedback from early childhood providers who can monitor and screen the children in the early childhood setting. Last but not least is integrating developmental screening into pediatric primary care. This is making sure that the child or children are having a routine developmental screening into their primary care setting. That certainly may seem daunting, but has its great benefits towards the child's health care. And now that you know all this information, you may be asking yourself, what in the environment of a middle-aged child can increase their biosocial development in relation to the application of their health care? Well, here is one of the main reasons, and that so happens to be for a child to come from a low-income family. And as you can see by this flowchart, it is defined as middle-aged children that are part of a family that has a background of low income tend to encounter many struggles, especially health-wise. A couple of these unfortunate encounters are: reason 1, lack of hygiene products such as shampoo, soap, toothbrush, toothpaste, etc. Reason 2 is that their environment isn't safe, so the children are unable to go to public spaces to do exercise like the park or their neighborhood because of the potential dangers that they may come upon. Reason 3 is the lack of personal items like clothing and toys. Reason 4 is lack of shelter. Reason 5 is lack of access to a good education. Reason 6 is lack of food and water resources. That means they have limited or none supplies to continue on a constant balanced diet. And the last reason is that their environment isn't clean or healthy, possibly that the child could be living in an area that's surrounded by factories. They create a lot of air pollution that could later create respiratory conditions such as asthma. And as well as their water can be contaminated with waste, making it no longer drinkable for both the child and their families.
Psychosocial development. Children begin to develop a better understanding of who they are and what they are capable of.
Industry
Moving
versus
on to
theory
significant
in the family and school.
and an
From the families,
increase
children in middle
of
school
social
need physical
comparison,
necessities, learning,
and with it, an
self-respect,
increased fear of
human
social
relationships,
rejection.
harmony and stability, structure,
Development
function,
of self-conscious
activity,
emotions,
cognitive
increased
development,
social
encouragement of
perception
growth,
independence from
and
adults,
emotional
more
and
intimate,
social
more
regulation
and intimate, but what do they
children
do?